Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study that investigates a potential way to help horses stay healthier during transportation, a common yet potentially stressful experience for these magnificent animals. As many of you know, horses are frequently moved for competitions, breeding purposes, and veterinary care. While proper restraint during travel is crucial to prevent physical injuries, prolonged confinement, particularly of the head and neck, can unfortunately lead to problems in their lower airways. Think about it. When a horse's head is held in an elevated position for an extended period, the natural mechanisms that clear mucus and bacteria from their airways can be disrupted. Research has shown that even relatively short journeys of a couple of hours can sometimes result in an increase in inflammatory cells within the airways. Longer trips can have more significant consequences, contributing to the development of respiratory illnesses like pneumonia, which can be life-threatening and potentially end a horse's athletic career. Transportation stress can also trigger a cascade of physiological changes, including increased stress hormone levels and alterations in immune function, further raising the risk of respiratory problems. Detecting the presence of respiratory pathogens in horses after long-haul transport highlights the potential for infection during these times. Recognizing these risks, researchers have been actively seeking effective strategies to maintain the respiratory health and overall well-being of horses during transportation. One idea that has been explored is lowering the horse's head below the level of their withers during transport to potentially reduce airway inflammation. However, other interventions, such as the use of certain antibiotics, have not proven effective in preventing airway inflammation in confined horses. The need for a reliable method to combat mucus accumulation and inflammation during transportation is therefore paramount. This brings us to the focus of the study we're discussing today, the potential of a compound called N-acetylcysteine, often abbreviated as NAC. N-acetylcysteine is derived from an amino acid and has been recognized for its ability to break down mucus. It has a history of use in human medicine for over 4 decades in treating respiratory conditions like chronic bronchitis. Beyond its mucolytic properties, NAC is also known for its antioxidant effects. Furthermore, it has demonstrated anti-inflammatory properties by potentially inhibiting the activity of pro-inflammatory molecules. While the benefits of NAC have been studied in humans, its effectiveness in horses requires specific investigation. This study aimed to evaluate the impact of N-acetylcysteine on reducing mucus buildup and inflammation in the airways of horses subjected to a period of prolonged head confinement, mimicking some aspects of transportation. The researchers hypothesized that keeping the head restrained for an extended time would indeed lead to the accumulation of mucus and inflammatory cells in the lower airways, and that NAC, with its mucus thinning and anti-inflammatory actions, could effectively counteract these negative effects. To investigate this, the researchers conducted a carefully designed study involving 6 healthy crossbred horses. The horses underwent 4 different conditions: a non-confined state, a placebo treatment without confinement, 18 hours of head confinement without any treatment, and 18 hours of head confinement with N-acetylcysteine treatment administered before the confinement period. In the confinement conditions, the horses' heads were restrained in their stalls for 18 hours, with their nostrils positioned above the level of their withers. The horses in the N-acetylcysteine group received a daily oral dose of 15 milligrams per kilogram of body weight of NAC for 3 days leading up to the head confinement, with the final dose given 2 hours before sampling. To assess the effects of these conditions, the researchers performed bronchoalveolar lavage, a procedure to collect fluid samples from the lower airways, in each of the 4 conditions. They also used endoscopy to visually evaluate mucus accumulation along the trachea. Blood samples were also collected to analyze complete blood counts and plasma fibrinogen levels. The study was meticulously designed with a washout period between each condition to ensure that the effects of previous treatments did not influence subsequent results. Now, let's turn our attention to the results of this important study. When the researchers examined the trachea using endoscopy, they found significant differences in mucus scores among the 4 conditions. Notably, the horses that underwent 18 hours of head confinement without treatment showed a significantly higher mucus accumulation score compared to the horses in the non-confined state, those receiving the placebo, and those treated with N-acetylcysteine. Interestingly, there were no significant differences in the mucus scores between the non-confined group, the placebo group, and the group that received N-acetylcysteine. This suggests that head confinement led to increased mucus, and N-acetylcysteine treatment appeared to mitigate this increase. In fact, all horses in the confined head group had notable mucus accumulation, while only 2 of the horses treated with NAC showed a lesser degree of mucus. The analysis of the fluid collected from the lower airways through bronchoalveolar lavage provided further insights into the inflammatory response. The researchers observed no significant differences in the cell counts between the non-confined and placebo groups. However, when they compared the horses with confined heads to both the non-confined and placebo groups, they found significantly higher total cell counts and significantly higher neutrophil counts in the confined head group. They also noted significantly elevated total lymphocyte and macrophage counts in the confined head group compared to the non-confined and placebo groups. Furthermore, the percentage of neutrophils was significantly higher, while the percentages of lymphocytes and macrophages were significantly lower in the confined head group. These findings strongly indicate that head restraint alone induces substantial inflammation in the lower airways of horses. Crucially, the treatment with N-acetylcysteine had a notable impact on these inflammatory parameters. The study revealed that the total cell count was significantly lower in the NAC-treated group compared to the confined head group. Similarly, the neutrophil count was significantly reduced in the horses that received NAC compared to those that did not during head confinement. The total lymphocyte count was also lower in the NAC group compared to the confined head group. While the total macrophage count did not differ significantly between the confined head and NAC-treated groups, the percentage of macrophages was significantly higher in the NAC group compared to the confined head group. The percentage of neutrophils was also significantly lower in the NAC group. Although there were differences in total cell counts and macrophage counts between the NAC group and the non-confined and placebo groups, the neutrophil counts and percentages were not significantly different, suggesting that NAC helped to reduce the elevated neutrophil levels associated with head confinement towards baseline levels. Interestingly, the complete blood count variables and plasma fibrinogen concentrations did not show significant differences across the four conditions. However, the microscopic examination of the airway fluid samples revealed that two of the horses in the confined head group had a considerable number of degenerative neutrophils, which are indicative of inflammation. In contrast, the samples from the NAC-treated horses showed lower cellularity and a less severe inflammatory picture based on total and differential cell counts. Moving on to the discussion of these findings, this study provides valuable evidence that N-acetylcysteine is effective in reducing mucus accumulation and inflammatory cell counts in the lower airways of horses subjected to head confinement. The observation that all horses in the confined head group developed mucus buildup, while NAC treatment significantly reduced this, highlights the potential mucolytic effect of NAC in this context. The significant decrease in total neutrophil count and the percentage of neutrophils in the NAC-treated group further supports its anti-inflammatory properties in the airways of horses under head restraint. These results align with previous research that has shown head confinement can lead to bacterial overload and inflammatory secretions in the lower airways, even without the physical stress of transportation. This study reinforces the notion that simply restraining a horse's head in an elevated position can trigger airway inflammation and mucus accumulation. The findings suggest that N-acetylcysteine could be a useful tool in minimizing the risk of mucus buildup in horses undergoing situations that involve prolonged head restraint, such as transportation. While NAC is not commonly used in equine medicine, this study adds to a growing body of evidence suggesting its potential benefits in horses. Previous research has indicated that oral administration of NAC can have anti-inflammatory and antioxidant effects in maras with uterine inflammation and can improve the redox status of skeletal muscle in athletic horses. The dosage of 15 milligrams per kilogram per day of NAC administered orally for 3 days in this study was effective in reducing mucus accumulation and inflammation in the airways. The potential mechanism by which NAC exerts its anti-inflammatory effects may involve its ability to modulate the cellular redox status and impact various inflammatory pathways. In laboratory studies, NAC has been shown to decrease the activity of a key regulator of inflammation and to reduce the production of pro-inflammatory molecules. NAC has also been found to inhibit the release of certain inflammatory signals from airway cells and to suppress the production of inflammatory cytokines by immune cells. Despite the compelling findings, the researchers acknowledged some limitations of their study. One limitation is that the study was conducted on stationary horses with head confinement rather than on horses undergoing actual transportation. While head confinement mimics some aspects of transportation, the additional stressors of movement, noise, and unfamiliar environments associated with travel were not present. However, the controlled environment of the study allowed for a clear assessment of the effects of head restraint and NAC treatment. The researchers also noted that they were unaware at the time of the study that a specific scoring system had become the standard for evaluating mucus accumulation in horses. Despite these limitations, This research provides a strong foundation for further investigation into the use of N-acetylcysteine in transported horses. The findings suggest that administering NAC orally before transportation could be a practical strategy to substantially decrease mucus accumulation and inflammation in the lower airways of horses during long journeys. The notable reductions observed in total cell count, neutrophil count, and mucus accumulation in the NAC-treated horses offer promising evidence for its potential use in preventing post-transportation respiratory issues. Furthermore, the study suggests that NAC might also have potential as a treatment option for horses suffering from other inflammatory airway diseases, such as asthma. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.